If you've watched the lab video, you've already seen this anatomic position, kind of like the Leonardo da Vinci man. He studied actually dead bodies, by the way. That's how he got so good at his drawings. But you don't have your arms spread out as wide. You have your palms forward and they're just kind of angled from the ground. And then your legs aren't splayed apart. They're about shoulder width apart. But whenever we start describing where something is in the body, just close your eyes and think about normal anatomic position in order to describe where something is. In the lab video, I pointed out that your nose is superior to your mouth, and your mouth is inferior to your nose. Those are a couple of terms. If you stand on your head, does that change? It doesn't. Your nose is still superior to your mouth. That's what we mean when we talk about using standard anatomical position. Just because the body was moved doesn't mean that things got rearranged. So it gives us it's great for medical notes if you're writing, let's say, where a wound is or where a sound might be. You use standard anatomical position to describe things. Directional terms. Again, this is going to be repetitious from lab, but we use directions in order to describe where something is. So there's some medical terminology that we're going to use. When you are looking at things like an X-ray or another person, when you're looking on the right, that's that person's left side. Let's say that person is facing you, and you say his left arm. Okay, well, you know it's his left arm, but when you're looking at him, it looks like it's on the right. And so what we're talking about is when we're saying left and right, you're talking of the being, not what you're looking at, but of the actual person themselves. So superior is going up towards the top of the body, towards the head. And inferior is going away from the head towards the bottom of the body. Anterior, also called ventral, is going towards the front of the body, so like chest side, abdomen side. And posterior, also called dorsal, is going to be towards the back side. So a shark's dorsal fin is on his back. Medial is going towards the middle, towards midline, and lateral is going away from the middle, so away from midline. We don't really use the term intermediate very often, so notice I have those two. This is in your book. The PowerPoint comes from your Marieb book company, but I've put the two purple arrows on the two that you need to know. You do not need to know intermediate. Okay, proximal and distal are always when we're talking about limbs. So I would say, let's say my head is not a limb. My head is superior to my neck. But when we're talking about limbs, so hands, elbows, shoulders, feet, knees, hips, that's going to be proximal and distal. So my elbow is proximal to my hand. The term proximal is going towards the body trunk, towards your body itself. Distal means you're going away from the trunk. So your hand is distal to your elbow, or your hand is distal to your shoulder. Superficial is more on the surface. Deep is going towards the center of your body. So your organs are deep to your skin. Your skin is superficial to everything. Your skin is superficial to your vessels, superficial to your muscles, superficial to your organs. So more on the outside. The term axial is going to be head, neck, and trunk. We'll do this in lab later, actually, and it's in the skeletal system. But the term appendicular is limbs. So they're appendages to your trunk. They're extras, right? All right, and then we have regional terms that are talking about specific body divisions. Now, this picture, again, it came from your lecture book. So when it comes to regional terms that you need to know for both lecture and lab, I'd like you to just memorize the ones that are in the lab book. You don't need to know all of these details for lecture or lab. Go by the lab book. Same thing on this one. Go by the lab book. So I've listed them out here on this slide. I don't know if the page is correct anymore. I'm sorry, because we've got a new addition to the lab book. So the page might be a little different. But here we go. And I pointed all of these out on the lab video. So I'm not going to belabor the point because this is just memorization. I can't really help that much with memorization except to show it to you. And I can't show you on a PowerPoint, but you can look at your lab video and you can see these things. Planes, same thing. We did this on the lab video. Lab and lecture go together, help you understand each other. But when we're talking about, let's say for surgery, you might do certain kinds of cuts. Or when you're looking at the models in lab, they're going to be certain kind of cuts. How they're cut is talking about the way that the section has been planed off. So a sagittal plane is going to be going down the middle, separating left and right sides. Frontal is going to separate front from back. And transverse is going to separate top from bottom. And I did this also in the lab manual, in the lab videos, but mid-sagittal is perfectly in the middle. Parasagittal is going to be not quite midline. It's going to be still separating left and rights, but it's not perfectly even. Frontal is separating the front part of the body from the back part of the body. Transverse is upper from lower. Oblique is actually when we have a slant to the cut. So it's going to be passing through something at an angle. I don't remember doing oblique in the lab manual, but this picture right here shows an oblique cut. See how it's angled through the body. Here's some more pictures. These are different kinds of cuts. So MRI image on the left is a mid-sagittal cut. So we're seeing exactly one side of the body, perhaps the left. A frontal cut is we've cut off the anterior or ventral part of the body and we're seeing more of the posterior part of the body. And the one on the right is showing straight smack through her midline. So you're getting to see the spinal cord and that's nestled in the spinal canal. The vertebrae is around it. You see a little piece of the spleen, a little piece of the liver. When you have MRIs or CAT scans, they do multiple pictures in the same plane. So perhaps multiple, let's say you're doing an MRI of the head or a CAT scan of the head. It's going to be imaging, let's say, complete transverse sections starting at the very top of your head, going down to your neck, and then it'll stop. And then you put all those things together to find where a lesion might be, like let's say a tumor somewhere in the head. Okay, cavities. Again, this is all in that lab video, but we have two major cavities, dorsal cavity and ventral cavity. They're going to get broken up. Your dorsal body cavity includes your cranial cavity. So cavity, just like it sounds, it's a space. What sits inside your cranium? Your brain. So your skull's cavity is called the cranial cavity. And then your vertebrae are protecting your spinal cord. So the bones, the vertebrae, have a cavity running down the middle of it. What's living inside of that? The spinal cord. So that's a vertebral cavity. Both of those are subdivisions of the dorsal body cavity. Then we have the ventral body cavity. So the ventral body cavity, this is both a lateral view and an anterior view. You can see, get this little pointer right here, this section right here, this is the thoracic cavity. The thoracic cavity is divided from the next cavity by this muscle right here, the diaphragm. And then we have the abdominopelvic cavity, which can be divided also by the abdominal cavity and the pelvic cavity. The pelvic cavity is not really defined so much. It's not as easy to see the starting and stopping point because we have a serous membrane there that's quite tiny. It's easier to remember what's in the pelvic cavity to know which cavity you're in. Not much. The bladder, some of the reproductive organs, and the rectum right before the poop leaves the body. So everything else is abdominal cavity. The thoracic cavity is actually divided into two parts because you have a left side lung and the right side lung. So those are plural cavities wherever lungs are. Then we have another area called the mediastinum or mediastinum, depending on who taught you, where we have the pericardial cavity. We don't get into the mediastinum very much, but we did get into the pericardial cavity. It's holding the heart, and it has different membranes on it as well. And I mentioned this already. The abdominal cavity has the stomach, the majority of the intestines, spleen, liver. The pelvic cavity has the bladder, the reproductive organs, and the rectum is the very end part of the intestines before the feces leaves the body. So I mentioned in the first PowerPoint how important it was to have compartmentalization. So everything is compartmentalized. So I'm telling you that we have a pleural cavity, then we have an abdominal cavity, we have a pelvic cavity. They're all kind of separated by different things. Well, if you know anybody that has a hiatal hernia, you know that they are uncomfortable. Well, what's happening is part of the stomach that's supposed to be in the abdominal cavity, it slips through the diaphragm and enters into the thoracic cavity. This causes a lot of discomfort because now we're having acid easily being introduced into the esophagus, which is the tube that leads into the stomach, and it hurts. It burns, hence heartburn. So that is a type of homeostatic imbalance. If that stays like that long enough, if it's bad enough, depending on how much slippage there is, that person might need surgery to get that fixed. Otherwise, they're going to burn a hole in their esophagus. That would be a very significant homeostatic imbalance if that happened. The serous membranes they're also called the serosa, seem to give the students a little bit of stress because they're kind of hard to see. They're kind of hard to visualize. It's not something that you've probably ever heard of before. It's a double layered membrane that covers things on the inside of the body. So serosal tissues, these membranes never meet the outside world, or they're not supposed to anyway, unless you're in homeostatic imbalance and somebody has opened up your belly or something. The purpose of these guys is to create a watery, slippery fluid, not a lot, just a little bit, and it goes between those two layers. And what they're doing is keeping everything nice and slippery on the inside and moist. It's mostly water. And again, it's not buckets of it. It's just, let's say if you've ever observed a surgery and the belly was opened, you see that everything looks shiny and moist. And that's because everything is coated with a very thin layer of serous fluid because of these membranes. Depending on where these membranes are, determines their name. So the heart, the serous membranes associated with the heart is called pericardium. The serous membranes associated with the lungs are called pleura. And the serous membranes associated with the abdominopelvic cavity is the peritoneum. Really, honestly, more abdomino than pelvic. So I'm telling you that these are double layers. And you look at this picture right here, we're looking at the pericardium. It's the serous membranes around the heart. And this makes it look like there's this giant space where it's pointing and it says pericardial space with serous fluid. I mean, by the size of the heart, that space looks like it's an inch, right? Well, in fact, they're touching each other and they slip across each other with just the tiniest amount of that serous fluid. The part of the membrane that's actually touching the heart. So organs are viscera. They're guts. Viscera is the name of organs. So the part that's actually physically on top of the heart is specifically the visceral pericardium. The sac that's around the heart, not adhered to the heart, is called the parietal pericardium. Both of them are really close to each other. There is a potential space there, and if a disease happens, that little area can fill up with blood or other kinds of fluids, even pus. That would be bad. It's all bad. But it's a protective covering around the heart because the heart's constantly going lubbed up, lubbed up, lubbed up. It's always moving, and it's protecting it, it's compartmentalizing it, keeping it nice and moist. The pleural membranes are in the chest, and they are around the lungs. So we have, again, they're right up next to each other, but the layer of this tissue that's on the lungs itself would be visceral pleura. The part that's lining the chest cavity, so immediately along the rib cage, but inside the body, right? That would be parietal pleura. And then same thing on the abdomen, where we have, because the abdomen is really where we have the peritoneum. Any of the serous membranes that are on an organ, such as the spleen and the liver and the small intestines, that would be visceral peritoneum. And the part that's lining the abdominal wall is parietal peritoneum. This is the area that's going to have more space because they're not right up next to each other. Let's say the visceral peritoneum that's on the spleen is pretty far away from the parietal peritoneum that's on the abdominal wall. But both of them are releasing that small amount of serosal fluid that's keeping everything nice and moist so that you don't get rug burn when you go for a jog. Your liver doesn't get all angry because your stomach is rubbing on it because you decided to go for a jog. If you get inflammation for some reason, like infection, some let's say it's something happened to your intestines. You got a hole in your intestines and they started to leak. That's going to make your peritoneum in your abdomen very angry because you are out of homeostasis. You are not supposed to have gut spillage into your abdomen. That's going to be called peritonitis. So itis is inflammation, peritoneum, peritonitis. Same thing with the chest. If for whatever reason that pleural membrane inside your chest gets angry, inflamed, it can be called pleuritis, or sometimes you'll hear the term pleurisy, and it hurts to even take a breath. It's very painful. Even though these layers are very, very thin, they're loaded with nerve receptors, so it's a very tender area to get inflammation. Okay, we can divide the cavity, the ventral body cavity, into different parts, and I did this in the lab. I'm going to tell you that this quadrant sectioning is super easy. You have the upper right, upper left quadrant, and you have the lower right and lower left quadrant. That's nice and easy. So that'd be great. Maybe if your doctor's describing where sounds are coming from, what sounds like the lower left quadrant of the guts are producing a lot of noise. But he's probably going to be a little bit more specific than that. He's probably going to go into the 9 divisions called regions. It makes like a tic-tac-toe grid. If you looked at the video for lab, you already saw how I cut out a little tic-tac-toe and put it across Mr. Man so you can see the different regions. And here they are. So the middle one's easy. Umbilical region, because there we've got our little belly button right there in the middle. Superior to the umbilical region, you have the epigastric region. Epi on top of gastric. And the reason that is because it's right on top of the stomach, gastric stomach. Lateral to the epigastric regions, you have the right and left hypochondriac region. Lateral to the umbilical region, you have the left and right lumbar region. And then inferior to the umbilical region, you have the hypogastric region. Now your lecture book, puts both terms, pubic region and hypogastric region. I'm going to stick with what the lab book says, so we're not learning too many things. So hypogastric region, and then just lateral to the hypogastric region, we have the iliac region, so the left and right iliac region. We have some other cavities, so we don't get into too much detail about oral cavity, digestive cavity, nasal cavity. All these things that are listed here meet the outside world. And so therefore, because they meet the outside world, instead of being serous membranes, they're going to be mucous membranes. So if it meets the outside world, they're lined with mucous membranes, which means they have the ability to create mucus. It doesn't mean that it's always making mucus. If your nasal passageway gets inflamed just because of some sort of pollen in the air, it might get runny, like a clear fluid. So mucous membranes can produce a serous runny fluid, or, so I shouldn't call it serous, it's just a runny fluid, or it can make a mucus a snotty kind of production. Serous membranes only should make a watery fluid. The other body cavity that is not exposed to the environment is going to be synovial cavities, which is very specifically joints that are freely movable. This is a Doberman named Miggy, and I have just entered into his abdomen. So I've cut a ventral midline cut, so a mid-sagittal cut on his ventrum. And I'm pulling that body wall out. And you can see with the forceps that I have in my right hand, I'm pulling on the peritoneum. That is the parietal peritoneum. I'm pulling on that very gently because it is very thin and it would be very easy for that to tear. It's not visceral peritoneum because I'm not on top of an organ. I'm pulling the body wall out so that you can see what's attached to it. And Miggy did fine. Miggy swallowed a sock. So I had to cut through Miggy's visceral peritoneum because I had to go into his jejunum, which is one of the parts of the small intestine, to get the sock out. Dogs. On this picture right here, I'm actually opening up, or actually I'm not. I just found this on the internet. But this is showing all the body cavities that I was talking about. So there's the diaphragm, pointer. There we go. Here's the diaphragm. So this right here is the pleural cavity, or the thoracic cavity, sorry. And then below the diaphragm is going to be abdominopelvic. Okay, so let's do the membranes. Here's a lung, here's a lung, here's a lung, here's a lung. There's a shiny, and if you tried to pull this serous membrane up, it definitely would tear. If there's a pin through the lung, and the question says, what serous membrane is this pin going through? It's going through the visceral pleura. Now notice here's the chest wall, and it's being pulled out laterally. But underneath, there's a rib, there's a rib, there's a rib, and in between the rib, you see lots of muscle. But there's a shiny surface right here. That shiny surface is parietal pleura because it is lining the chest cavity. Again, in a live being, these two things are right up against each other. So there's potential space, but there shouldn't be a space for the chest or for the heart. Now this heart has a sac around it, so the sac is the pericardium. What I see right here, I see some fat. That means that I have not cut through the sac because I see a lot of fat. The heart itself doesn't have as much fat as the sac does. So I'm looking at right here the parietal pericardium. If I cut through this, then I'd have a better view of the heart itself, and then I could put a pin through the heart, and that would be the pin is going through the visceral pericardium. Finally, here's the abdominal. I'm just going to do the abdominal area right here. Here's liver, and here's spleen. So if I put a pin through the, let's do spleen, then I have put a pin through the visceral peritoneum. And here they've pulled the abdominal wall out laterally. So if I put a pin through the abdominal wall, then I have gone through the parietal peritoneum. That shiny layer right there is the parietal peritoneum. Imaging. So X-rays have been around for a long time, and they are great, especially for dense tissue like bones. For things like all the guts on the inside, it produces shadows. It produces different colors of gray. But air is black, and bone and mineralized things are much more white. So X-rays are great for bone. It's not that you can't use X-rays for, let's say, the liver. You could see a really enlarged liver, but maybe if there's like a 1 centimeter tumor on the liver, that X-ray is not going to get it. You need a different modality. When you take X-rays, this is very important. I usually put this on every lecture test. You need a minimum of 2 views. You need the beam running laterally, so you get a lateral view, and then you need a beam going from the anterior side to the posterior side. Now on here I put ventral dorsal because I'm a veterinarian, and so animals are on 4 legs, so It's not called AP, anterior posterior, it's called ventrodorsal. So same thing though, remember? Anterior is ventral, posterior is dorsal. But you have to take two views because it's a two-dimensional picture of a three-dimensional object. So you have to have it going through both ways so that you can learn or you can evaluate where something is in the body. X-rays put out radiation, high amounts of radiation, and so does a CT scan is essentially X-rays, but many sections. So often it's going to be a transverse section, also known as a cross section, and you put it together. So what's the disadvantage of X-rays? What's the disadvantage of a CT scan? It's lots of radiation. You can see how beautiful you can really see the bones on this X-ray right here. You can see some of the soft tissue. So this is a beautiful X-ray overall. You can even see the folds in this person's hand and his thumb, his, her, whatever. But you know, if there's actually something going on in here, maybe an X-ray wouldn't be the best way to look at that muscle. There's better modalities. But if you want to see if a bone has something going on in it, X-rays are amazing, easy, and inexpensive. MRIs are not using radiation. MRIs are using magnets. So what's end up happening is there's going to be movement because of the magnetic fields. You're going to have radio waves causing a signal. And you don't need to know all the details of this, but it's really not used for bone. It's great for soft tissue. So X-rays are great for bone. MRIs are really better for soft tissue. Soft tissue are things that aren't mineralized. The disadvantage is because it works on magnets. If you have certain kinds of metal can actually be ripped out of your body. Every year I have somebody ask me what kind of metal, and I'm not sure. But it's not going to be gold. It's not going to be silver. Maybe certain things that have been used to pin a bone or shrapnel from war. If you were unfortunate enough to be in let's say Iraq or something like that and get some shot in you, then that would potentially be ripped out. It doesn't matter where it's lodged. These are strong magnets. And then also an MRI is very expensive. Positron emission tomography, that's a PET scan, and usually what they'll do is have you take in some sort of relatively safe radioactive substance, and glucose is a common one used. So it's actually going to be an isotope of glucose, and let's say cancer divides quickly, so it needs lots of sugars because sugar is going to help us make energy, sugar and oxygen. And so cancerous areas are going to take up that radioactive glucose, and it's going to be highlighted in a PET scan. Ultrasound is sound waves, super safe. Also great for soft tissue things, and of course everybody probably knows that ultrasound's used to look at babies in pregnancy. It is an excellent, safe, relatively inexpensive modality to look at things. Not great at looking at bone, not great for looking at gaseous areas, so like your lungs are essentially full of air. Not great for normal lungs, but if there's a giant tumor in the middle of your air-filled lungs, the tumor's not going to be full of air. So it actually would show up. Same thing with guts. Now, for intestines, I mean guts. For now, ultrasounds are so detailed. They do use for intestines sometimes, but liver, excellent. Heart, excellent. Spleen, excellent. You get the idea. Even muscle, looking for blood clots. So DVTs, deep vein thrombosis, excellent. So this is a dog, and this is a lateral view. And this little dot right here is a BB. This head this way, tail this way, liver, heart, and then lungs. Notice how lungs are full of air. They should be. And so they're black. Outside of this dog is black. So X-rays, air, black. Bone, mineralized, more white. And then all the organs are shades of gray. And of course, organs are on top of organs. So the more organs that are there, the more white it becomes. It's more stuff. So this BB looks like it's going right smack dab into this dog's heart. This is why we take two views. Here's the BB. The BB is actually just lodged underneath the dog's skin. X-rays, you must take two views because an X-ray is a two-dimensional picture of a three-dimensional object. So you could see on that previous one, it looks like that BB is in that dog's heart, when in fact it's just burrowed under the skin. X-rays, radiation causes cancer. In 1895 is when Wilhelm Rontgen discovered this X-ray capability and made machines. And so in the early 1900s, they actually had salesmen going door to door trying to sell these machines. And women didn't work. They're at home and they're bored, and somebody comes and knocks on the door and they have this cool toy and they're going to entertain them. They're going to allow them in their house. And so how would the salesman try and sell this? Put his hand in the X-ray beam, take a picture, and then show the housewife his hand. So this right here is all radiation damage for that salesman from repetitive X-raying of his hand. And this is a cancerous mass right here on this person's hand from repeat X-ray units, repeat X-ray exposure from trying to sell the unit. So radiation in excess definitely causes cancer and tissue damage.